Good morning, everybody. I hope you're enjoying the fabulous weather that we've had over the weekend. Following on from the staff briefing last week, I thought I'd just give a few updates in relation to COVID, some updates from our colleagues, and the work that we're doing around supporting BLMK NHS colleagues across the three CCGs. So, just in terms of the COVID update, Bedfordshire, Luton and Milton Keynes are seeing the same trend as for the rest of the nation, in that the number of admissions to our acute trusts and hospitals are coming down. The death rate and mortality rate is dropping, which is really good news. We're continuing to work with our partners across health and social care on the impact of lockdown, particularly as some of the lockdown measures are now changing from this week, with some schools going back and children going back to school. We're fully prepared in terms of meeting any increase in demand, but clearly we're a little bit worried about a potential second wave further down the line. We've also managed to provide COVID testing for over 10,000 staff across BLMK, and the CCG staff have been fronting quite a lot of that in terms of doing the actual tests, so that's really good news. Updates from colleagues. Well, we've been hearing from our primary care colleagues, GPs and others in primary care, of the great work that they're doing. We've got about 101 practices across the entire patch of Bedfordshire, Luton and Milton Keynes. And 100% of our practices are now using technology to do predominantly non-face-to-face consultations with patients, screening patients and so on. So that's a fantastic endeavour. And this week we're supporting the rollout, or the national rollout, of the infection prevention and control training across our some 230 homes across Bedfordshire, Luton and Milton Keynes. We've got 7 super trainers who are super infection control specialists, supporting 30 volunteer trainers across predominantly the CCG, but also from our local authorities and community providers. And I'm really happy to report that as of Friday, we'd cover the majority of those homes. So virtually 100% of training offered to all practices, and the majority of practices trained actually by 4 o'clock on Friday. So I've received an email this morning from Anne Radmore congratulating us on our fantastic achievement in terms of providing that training to care homes. And we will continue to support our care homes, who are doing a fantastic job out there in terms of caring for our predominantly older people and others. We are also having a focus internally across the 3 CCGs on Mental Health Awareness Week, and have been doing a number of staff resilience training sessions across the CCGs, which have been really well received. And we're doing our own kind of fun thing across BLMK. We had our first BLMK staff quiz last week. The exec team came fourth. I'm bitterly disappointed, not bitter, but fantastic news for the other 2 teams who came joint first. But we're also doing, and tomorrow we've got to have our photographs in, so I hope many of you are going to be doing this, BLMK in Bloom. Chelsea Flower Show unfortunately couldn't be held, but we're doing our own virtual BLMK Flower Show and encouraging everyone to share their green spaces and what they've been proud of in terms of gardening, and demonstrating that one element of well-being and how gardening can be a very positive element of well-being. So that's the sort of key updates in terms of CCG across the last week, and I'll look forward in terms of the wider staff forum this week sharing more. So take care all, and see you all on Wednesday. Take care. Bye.